Aloha and welcome to Japan America Society of Hawaii's Japan Currents Program. I'm Reina Kaneko, President of the Japan America Society of Hawaii, otherwise known as JASH. We send a big aloha to our audience from all over the state of Hawaii, the continental USA, and Japan. Thank you so much for joining us today. We have an exciting program with 4 expert speakers in the fields of public health and travel industry, and they are bringing the most current, up-to-the-minute information on these topics as it relates to the US, Japan, and Hawaii. Before we begin, I would like to go over some housekeeping items. The program today is in Zoom webinar format, which means we will see only the guest speakers on screen. We welcome your questions and will entertain them after the speakers have completed their presentations. Please type your questions in the Q&A box. The chat box is disabled. We are very fortunate to be able to bring the Japan Currents program to you through the generous sponsorship of the Embassy of Japan and the support of the National Association of Japan America Societies, or NAJAS. At this time, I would like to introduce Mr. Peter Kelly, President of NAJAS, to open today's program.
Thank you, Reina, and welcome all. I'm Peter Kelly of the National Association of Japan American Societies in Washington, D.C. NAJAS has 38 member societies all around North America, and one of the most active is the Japan America Society of Hawaii. Our job at the National Association of Japan America Societies is to provide program opportunities for our member societies. And we have events in public affairs, in security, in youth exchange, culture, and business speaker series. And the Japan America Society of Hawaii has been awarded grants in nearly all of those categories. So congratulations to Reina and the Society. Tonight's event is part of the Japan Currents series, our public affairs series. Each year in the first 3 months of the year, we offer Japan America Societies the opportunity to present a program on public affairs relating to the US-Japan relationship. The topics are always chosen by the local societies, and we always have a speaker from Japan and one from the United States to make sure that the information you have on these issues of importance in the relationship is current and is from experts. Tonight, as Reina mentioned, we have wonderful experts on an issue of great importance in Hawaii and everywhere else, public health and the resumption of travel. So thank you to the speakers, all of you who are participating, to the Japan America Society of Hawaii, and I look forward to the presentation.
Thank you, Peter. Thank you so much for that wonderful introduction. So at this time, I would like to do an introduction of the speakers regarding public health. Lieutenant Governor Josh Green is the 14th Lieutenant Governor of the state of Hawaii, serving since 2018. Lieutenant Governor Green came to Hawaii to serve the National Health Service Corps as a physician for the Big Island. He has remained a physician in Hawaii's rural emergency departments while serving in public office. Welcome, Lieutenant Governor Green. Dr. Norio Ohmagari is the Director of AMR Clinical Reference Center and Director of Disease Control and Prevention Center of the National Center for Global Health and Medicine in Japan. Dr. Ohmagari is engaged in the care, prevention, and research of infectious diseases from a global perspective. In addition, Dr. Ohmagari's work includes the on-site response in infectious disease crisis management in Japan. Our moderator for today is Ms. Barbara Tanabe, owner of Hoʻakea Communications and JASH Board Director. An Emmy Award-winning news anchor, Barbara's illustrious career has taken her from news reporter to news anchor and then on to becoming a top public affairs professional. Welcome, Barbara, and I will turn it over to you.
Thank you very much, Reina, and thank you very much, Peter. NAJAS has always been so supportive of our chapter events, And we really do appreciate the national outreach that NAGIS provides for us. I also want to thank Dr. Green and Dr. Ohmagari for participating in this. I think it's going to be very informative. We have, I think, over 100 registered from, as Reina has mentioned, throughout the continental US and in Japan. I might add that I want to share a little bit of very good breaking news in case others have not heard. But because Hawaii's infection rate has been relatively low, in fact, very low in the last 2 weeks, the restrictions will be relaxed a little bit more. And it will be great news for our travel industry here in Hawaii. We are hoping that it will also encourage more visitors to come to Hawaii. However, we also understand that it's up to those destinations to also control the infection rate. So we will begin first with Josh Green, our Lieutenant Governor and also physician. Josh has been the voice of the Hawaii government in the pandemic relief effort. So Josh, we understand you have some slides and you want to share your screen as we do your presentation. So please go ahead.
Thank you, Barbara, so much, and Peter and Reina and all of JASH and everyone who's participating and welcoming me. So thank you for that. I'm going to share my screen in a moment. Let's see. And that is okay. Let me see. Let me see if I can get this. Forgive me. I don't know. Forgive me. Do you have my slides there?
We see that you are sharing your screen. We don't see the slide just yet.
I'm going to navigate this here in one moment. It's forgive me. Okay, forgive me here.
Lila, do you have a backup? Do you have a copy in case Josh's screen doesn't work? Are you able to put that up?
Yes, we're getting that ready right now. Thank you.
Okay. So Josh, we'll have a race to see if you do it or we do it. Either way, as long as we get those slides up, as soon as you see it, you can start. There we have the slide up.
There we go.
So Josh, you can go ahead.
Forgive me. So I'm an ER doctor, which does not imply any significant intelligence or ability to do tech. So thank you very much for the help. Thank God. So I serve as Lieutenant Governor. I'm also an emergency room doc, and I'm going to speak from that perspective. So if we might go to the next slide. Thank you for this. Here you can see, everyone, this last week, how low our COVID rates are. We are lowest in the nation. And this is very important to not just us as family members and people who live in Hawaii, but also internationally, because people can get the idea that Hawaii has been the safest state in the country. We are about 5 times below the average number of cases you'd expect for a population of our size. So that's been a blessing. So you can see how low we are right now as compared to other states. And if you look at the next slide, it will reflect where we've been for the whole pandemic, beginning on March 7th of 2020, when we started to really keep this kind of data nationally. So again, with the exception of a couple other rural states like Vermont and Maine, and maybe Oregon, our rates have been so much lower, due in large part to the Pacific Ocean. Another major factor has been our commitment to wearing masks, and people are very mindful in Hawaii, both culturally and from a health and public health standpoint, of the need to prevent significant spread. So we've been the lowest for the whole measured pandemic. And then the next slide, perhaps even more importantly, is where we've been as far as the death rate goes. We have the lowest death rate in the nation. And again, we hope that this not just is a blessing for us, because we were projecting over 4,479 deaths, but we've been able to keep the number down. It's right now at 435 people have passed away. So about a 90% decrease in what our expectation was because of people's commitment to safety. And then the following slide is for the entire pandemic. And that, once again, we've been blessed to be the lowest. So we hope that this will translate not just to good results now for our families, but also as we begin to return large numbers of people, because I do believe we will soon go back to about 60 to 70% of our baseline of travel as soon as we change some of our policy to allow vaccinations to guide us and to allow people to come without having that pretest. It'll be encouraging to people to come to a safe place. Now, on the next slide, you can start seeing some of the the obvious overviews that we give, and they do work. Wearing masks, washing our hands frequently, and being distanced 6 feet apart does stop it. State of Hawaii has over 300 contact tracers. We were failing initially on this front, but we did get our act together. We isolate well, and our healthcare system has been very efficient in taking care of people. We have all the major modern medications that we have to have, whether it's remdesivir or steroids, oxygen, ventilators, and so on, including also antibody therapy. So we've done pretty well. We also have the Safe Travels program, which everyone's aware, I think, opened. I wrote that plan with a lot of good people to start on October 15th, so you can get a pretest within 72 hours of travel. And that's greatly minimized the risk of spread on planes, en route, and here in Hawaii. All of these things have helped a lot, and then we'll get to our vaccination program. So if the next slide can come up, please. You can see where our mask wearing rates have been based on surveys from our Department of Health. Statewide, 90%. That's usually the threshold nationally and internationally to have a very good result. Hawaii County, the Big Island, 98%, and their case count's down at 2 cases today. They're averaging, I believe it's 2.7 cases a day for the last 7 days. It's almost negligible. Maui County is at 91%. They've had a small surge, but by relative standards to any other county in the country, they're still very low. They had 24 cases today, extremely low for a population of 140,000, although we would love to have it be far less, and we need to make sure we don't let this get out of control. City and County of Honolulu, which, as Barbara very eloquently described, has been able to lower its threshold on and rules and restrictions on convening as of tonight at midnight. So the gatherings will be a little larger. People will still be asked to wear masks, but we'll do all we can to keep it safe. And then Kauai has had almost no cases, but did suffer quite greatly by being closed at great length. It's great to keep cases down to 0, but also there are consequences, which is that we have no economic activity. It's very difficult on people. So we have to rectify that problem and all others while keeping COVID down. Next slide, please. Here are some of the consequences of the COVID pandemic. In Hawaii, we use MedQuest for our free insurance. As you know, we had 330,000 beneficiaries before the pandemic, and now we have 380,000 people that can't afford health care. This is a great strain on people and families and our state. And so this will have to also be repaired as we put people back to work, which it will. Mental health care suffered greatly. People feel lonely, a sense of depression, pessimism, although that will also drop now that we're opening up and we're seeing light at the end of the tunnel. But we had lots of extra calls for mental health care. And I've seen that in the hospital myself. A lot of individuals have sought care because of desperation. Domestic violence is also a great concern. I'll share a somewhat personal story. There was a tragic event in the building that I live in, which a lot of people read about in Honolulu, where a woman was terribly attacked. Turned out to be the apartment next to mine. A nice building, a very nice hall, very nice people in general, but some person cracked and did a terrible thing. And so it comes home. It was right next to us, and that person will probably go away to jail for life for what he did. So you can imagine how, when my family, my wife and daughter and son witnessed that, we were not only aware, like when I see these things in the hospital, but also aware how real it is and immediate it is for so many people. Thank God that woman has survived and is doing much better. But food insecurity is also a big challenge for us. 1 in 5 residents in Hawaii became food insecure because of poverty as a result of being shut down, and then housing. We had 11,000 plus households that couldn't pay their rent. So we did freeze, we put an eviction moratorium out so that no one could be put to the streets. But all these are consequences of isolation and the devastating effects of COVID. Next slide, please. You can see what happened and where we are now by looking at right after Christmas time, Christmas, New Year's, we had a surge where 105 people were in the hospital, and now that number's back down to 34 in the hospital. Our average case count was almost 140. Now it's at 51 per day over the last week statewide. Statewide positivity rate dropped from 3.48 to 1.15, and each county has improved very dramatically in most cases. But even Maui, that's having a bit of a surge, has fewer cases overall. So things have gone well, knock wood, and they should continue to go better as we vaccinate somewhere between 7,000 and 12,000 people every day, which is not a small number given the small size of our state. Next slide, please. Here's some of our numbers on the Safe Travels program, and we really do encourage people to come to Hawaii. I would strongly encourage those who are Japanese who would like to come, provided that we can continue to work together as family and friends. My wife is Japanese, as you probably know, and some of our relatives are there. It's a great challenge because the Japanese government is being very careful not to have any spread from any part of the world back to Japan. But we are safe, and so we'll continue to work to make sure that people can travel freely between Hawaii and Japan. You can see that we've screened almost 1.5 million people since October 15th, and 1.3 million have been exempt. 89%, a million plus of these people have been visitors over the course of 4 months, and 400,000 residents. So you can get a pretty good idea of what it looks like each month. Next slide, please. Here are some of the economic consequences in our passenger count. I think you get the idea. We dropped 99.6% in March when we shut down, and that has to be reversed. And fortunately, with vaccinations and our good numbers, I have every expectation we'll be in the 20,000 to 25,000 range of travelers a day in the relatively near future. I think by summer and fall, we will definitely have numbers that are like that if we continue to do well. Next slide, please. This is a view of what happened. We had a large surge in summer, which was terrible after July 4th. Very reckless behavior on the part of some, and that caused a gigantic surge first of cases and then hospitalizations. Peaked at 318 people in the hospital with COVID. And like I mentioned today, we're at 34. And you can see the second surge we had right after the holidays. And you can see how illustrative it is. We've been able to keep very good control of the total number of cases when we're not following a holiday where people let down their guard. And the travel cases are represented in blue, light blue for our own residents that come back and unfortunately spread the disease if they're back at work or with family. And the dark blue, very, very few travel related cases. I would almost describe it as negligible. In fact, it's negligible from the standpoint of anyone becoming too sick or not being able to get good care. And it has not impacted our own safety whatsoever. That was the pre-travel program's result. Next slide, please. Here's an idea of what happened with our unemployment. You can see it skyrocketed in the weeks after shutting down to almost 150,000 individuals and fell backwards into a much better number. The claims have dropped precipitously, and we will, I believe, get back down to our baseline of unemployment, which was like between 2 and 3%, hopefully by the end of the year. It's very likely it'll certainly be under 5, and that means we will have recovered economically, with the exception of those, and it was a significant number of people in small businesses that couldn't make it back. So we're going to have to find new opportunities for people to care for them. But we've done all that we can to be supportive with some public aid, but that can't go on forever. So that's one of the reasons that I'm trying to create some inertia constantly to open not just our economy, but our schools and what have you, as long as it's safe from a health standpoint. Next slide. Here's the economic pulse data from the UHERO. That it's a little harder for me to grasp and how this would impact our group today, but you can see we got a bump after October 15th when we reopened, and that will take another big jump after we reopen with a vaccine passport, which is just to say a way to demonstrate that someone can show that they had a vaccine done. I usually like to say, finish your vaccine plus 2 weeks to get full immunity. And then we should make that our policy to have people travel here safely. Coming down the home stretch, a couple more slides. I would prefer that arrow at the 1B was actually in the right place, which it should be toward the end of 1B. That's just meant to show that we are in phase 1B. And we've given 318,000 doses. We gave 6,437 yesterday. We did another 10,000 since. And so in the next slide, you can see a broader view of how many doses we've gotten shipped here. We're now going to have 422,000 vaccines in state, and that'll be by the end of the week. We actually have added 50,000 since I last printed this slide last night. And so we're at 385,000 doses in the state, and we'll add another 37,000 in the coming few hours. So we're administering them as quickly as we can now. And if you look at the next slides, you can see which groups we're going to. Mostly our kupuna, our elders, and we will continue to make that our priority, but we're also moving to some of the other frontline workers, and we'll go down to age 70 to 75 in about 10 days. and then we will subsequently go 65 to 70. Plus, we're going to take care of individuals with severe disease. And that means if they're oxygen dependent or on dialysis or have cancer. But 13.6% of our people as of yesterday already had some immunity, plus the people that have caught COVID, which is, for the record, 27,000, but probably 3 times that if you really imagine how many people were exposed. We just can't confirm every case. Next slide, please. These are the comparisons between the islands. Maui's actually doing better than that. They just were unable to upload some of their data, about 10,000 shots into the system that's called VAMS. So they're very similar to Big Island. And you could see that Kauai is kind of jumping ahead a little because they have a pretty straightforward operation. There's just one site and a small population, relatively speaking, with about 70,000 people on Kauai. Honolulu, much larger population, is really racing forward. And I think my last couple slides here. Here are the 1A category, that's healthcare workers and our elders that live in nursing facilities, 50,000 people. Next slide. 75 plus, that's 109,000 people in Hawaii, plus frontline essential workers, another 50,000 individuals. The next slide shows our frontline essential worker description, people who have to keep the state going, like our energy infrastructure or transportation. They were prioritized, although everyone is essential, honestly. It's just these were individuals who were most vulnerable if they were sick, we couldn't keep the state going. The next slide shows where we'll be in 1C, which is very soon, imminently, like I said, about 2 weeks. 65 to 74 is our next priority, although we'll do first 70 to 74. People with those challenges with their health and all the rest of the essential workforce. So that's another 400,000 people. And then when we get to May, and we'll go to the next slide, you can see that we'll go to these other considerations. We're going to make sure that people can get vaccinated between stages. If there's a big outbreak, we'll vaccinate that population or that area geographically to stop clusters. And then the next slide shows where we'll be for everyone else, which will be sometime in May. We'll get to all the healthy younger people, and then thereafter our children who may or may not even be approved for vaccination. We don't know yet. And I think there might be one more slide just so people know where to go. Go to hawaiicovid19.com. And right now we're signing up our kupuna and frontline workers, but in the next few days, we'll open these up for more registrations and more opportunities. And in my opinion, when we touch into May, we'll be done with the 1C category and we'll be very safe as a state and have very minimal vulnerability. So if I prevail with my arguments, we will open up much more broadly and welcome everyone that would like to travel as long as they get a vaccination or take a pre-test. And we'll please encourage people to wear masks. So if I may stop there, Barbara, so I don't take too much time. I'm sorry if I went long. That's where people can find me on social media, and I'm at your service.
Thank you very much, Josh. Before we go to Dr. Ohmagari on the Japan situation, we know that you and your family were exposed to COVID-19 early on. How was that experience? Are you all okay now? Are you all immune as a result?
Thank you so much for asking. We are all okay. My family is beautiful and smart and healthy, and they're just great. We have a mixed Hapa family, which is a joy, which diluted my Polish genes very successfully, which was a great move. But yeah, I was just sick for 2 days. My wife lost her sense of smell, so we think she caught it, but she never converted with antibodies. She's 7 years younger than me. I'm 51. So she hasn't yet been vaccinated, but has been very safe. And Maya, who's 14, has been at her private school at Iolani completely safely, no cases. And Sammy, who's 10, has been at home most of the time getting distance learning. And he's, a pistol or, just a trickster. So everyone's fine, but we look forward to vaccinating. Yeah. And I did get vaccinated thereafter too.
Well, thank you very much. And it's good to know that the family as well. Now let's turn to Japan, because the situation there is quite different. It's a larger country. The vaccination program has not begun. And there's been great concern of travelers coming in. So at this point, I'd like to go to Dr. Norio Ohmagari. And thank you very much for joining us, Dr. Ohmagari. And if you could just let us know what the situation is now in Japan.
Thank you, Barbara, for your kind introduction. And first of all, I thank you for all and for you all who are involved in this, event, for inviting me. And I'm very happy to talk about the situation about the COVID-19 here in Japan, especially in Tokyo. First, my name is Norio Ohmagari, and I'm from the National Center for Global Health and Medicine. And I'm a clinician and involved in the treatment of infectious diseases. And at the National Center for Global Health and Medicine, our center, we treat patients with COVID-19 directly. It was just, I believe, 1 year ago that I started treating patients with COVID-19. Actually, my first patient was from Wuhan. 1 year has really flown by. And in January last year, I had a mission to receive Japanese people coming back from the Wuhan by the special, airplane. And also in February, we had to deal with a very big cluster, huge cluster of the Diamond Princess, the cruise ship, when it called at the port of Yokohama. And at that point, we had a very busy time and hard time. But during that period, we collaborated with US experts. First, I met Dr. Richard Child. Dr. Child is a physician and a researcher, very renowned researcher at the National Institute of Health. And actually, he was responsible for locating all the American patients admitted to medical facilities throughout Japan. And he was helping them to recover, and he was supporting their family and supporting also for them to return to the US. And in fact, we had a very sick American man in a hospital who was in a quite severe condition, which was requiring ECMO, extracorporeal membranous oxygenation, for the, to give supplemental oxygen directly to him. And Dr. Chad came over to our hospital to explain the situation to his family and quite encourage them. The patient made a great recovery over the next 3 months and returned home safely to Colorado. The family has been sending emails, quite kind emails to our hospital, and ever since. Actually, on Thanksgiving, they also sent us a picture of the patient who had recovered. The staff at the hospital, in our hospital, was quite happy to see him looking so healthy. In addition, thanks to our relationship with Dr. Chad, US and the US, a clinical trial of remdesivir was studied in Japan in the form of an international joint trial with the United States and Japan, and also other countries as well. The trial showed quite good results, and as a result, remdesivir was approved in Japan last year in May, I believe. As you can see, like this, even in the midst of a severe emergency, the US and Japan have been able to work together to deal with this situation, quite tough situation and a difficult situation. And I am convinced that as a result, many patients have been saved and new friendships have been formed. The current situation in Japan is what is known as the third wave. The first wave in Japan happened between March and May of the last year. And it was the first time for us to deal with it, and it put a lot of strain to our hospital. Actually, all 8 beds in the intensive care unit at our hospitals were occupied by patients with COVID-19, quite severe COVID-19 patients. And actually, next wave came after July. At that time, there were clusters of patients mainly in the downtown area of Tokyo. And actually, one of the characteristics was that infection spread mainly among the young people. The number of seriously ill patients were also small. It was quite small on the second wave. And after the second wave, the number of new positive patients per day in Tokyo was around 100 to 200, and it did not go down easily. This kind of situation continued for weeks, actually months, until the temperature suddenly dropped in early December, and the number of patients rapidly increased since that point. And actually, this was the beginning of the third wave. The peak in the number of the patients in early was actually located in early January, and it was a very difficult time for medical institutions in Japan. But unfortunately, the number of new positive cases has been on the decline since then. There are still many seriously ill patients in the hospital, but the situation is gradually improving and the situation is calming down, fortunately. And we do hope that the number of new positive patients will go down, just keep on going down. However, a mutant strain, actually a couple of the mutant strains have also been identified in Japan. And there is a big concern about the increase of the mutant strains. The future situation in Japan is, in this point of view, unpredictable. Talking about the vaccination, I'd like to introduce the situation in Japan. In Japan, the vaccination for healthcare workers started just started last week. And the vaccination campaigns for healthcare workers and the elderly will begin in the near future. And actually, I'm going to have my first shot in the next week, hopefully. And probably talking about elderly, actually the Prime Minister Suga just declared that they will start the program for the vaccination for the elderly in early April. In the US, I know that the vaccinations have been available for a long time. However, in Japan, it's just in the beginning. Talking about the general public's reaction to the vaccine, actually, which is quite positive in Japan. Their daily news, their news reports, and also the vaccine on the vaccine on TV and the media. And on the other hand, people living in Japan are very cautious about the vaccination. I feel that this is due to the fact that the problems caused by the side effects of vaccine in the past, which have had a strong influence on the social awareness in terms of the vaccination. In the media, there is a lot of information about adverse reactions to vaccines, and actually people is demanding for that. So we as experts have quite high expectations for the effectiveness of the vaccine. However, if the negative view of the vaccine spreads, in the community and in the society, the vaccination program in society will not progress. So I believe that it is quite important, very important, to provide the general public with accurate and unbiased knowledge about vaccination. Due to the effect of the third wave, Japan has imposed restriction on the entry of foreigners again. It's really sad. I'm not able to give you an outlook of when this will be eased at this point. But I think that the number of new positive cases needs to be dropped sufficiently for them to decide. We also need to take adequate measures against the influx of mutant strains. There are major epidemics in many countries around the world because of these mutant strains. In addition, the spread of mutant strain is becoming a problem in many countries. I think it's quite important to find a solution to these problems as well. And lastly, I think everyone is quite interested in whether or not the Olympics will be held in Tokyo and this year in the summer. From our point of view, it would be desirable if the Olympics could be held in the condition where all the people who come to Japan and live in Japan can feel safe. In order to achieve this, we needed to keep a close watch on the domestic epidemic in Japan, and actually we have to work very hard to suppress it. And we also need the cooperation of many people, including medical institutions and also the guests from the other parts of the world. Okay, so this is the end of my talk, and thank you for giving me a chance to talk this. Thank you so much. Over to you, Barbara.
Thank you very much for the very comprehensive review. We have had questions coming in, but I'd like to begin with my very own question, and that is regarding the Olympics. Everyone's looked forward to it for a year. It's supposed to start in July.
Right.
And it sounds very much like there is a firm commitment to go. Will most of Japan be vaccinated by then? And what are some of the mitigation steps that we would need to take if we want to come during the Olympics from outside of Japan? So there's two questions. Are you going to have enough people vaccinated? And what about travelers coming in? Do we still have to quarantine for 2 weeks?
Well, very tough question. Talking about the first question, honestly speaking, I don't know for sure, but I expect that at least, the most high risk, the people at highest risk, like elderly, will be, vaccinated. The significant number of the elderly will be vaccinated by this summer. So I hopefully, that this vaccination program in Japan will cover those, the people at high risk. I think it depends on the situation of the vaccination, the vaccination program itself. Second thing, well, this is again very important, quite difficult, very important but difficult question for me. 2 weeks of quarantine. Well, I do know that this is a quite tough, the quarantine program. But in my point of view, we have to continue that for the time being, up until we can, decrease the new incidence, the number of the new cases of the COVID-19. Then we can think about, easing this kind of quite, how to say, strict, quarantine program. So I may not have clear answer to you, but, sorry for that.
Well, thank you very much, Dr. Ohmagari. Dr. Green, there was a question that came in about vaccinating youngsters. You did mention that we're not there yet. It sounds like it'll be vaccination for those who are older than 16. What about younger than 16? What about them? How are we going to protect them?
So two ways. Well, first of all, the good news is that it has not severely affected our children. So the disease itself, with just for very rare circumstances where it caused an inflammatory disease state, have they gotten very sick. We do believe that some of the vaccines will move down to at least age 12. The ages between 5 and 12 have been utterly rare sickness, very, very minimal. I do think we probably vaccinate children 12 and up at some point, which are they're almost becoming young adults. And we're waiting for the guidance from Pfizer, Moderna, and the other companies to give us some research data. They just didn't do enough sampling in those categories. Probably summertime before the next school year, we'll be able to do that, assuming they approve it.
Okay, so then another question comes up. Can employers, bosses, people who own businesses, force employees to get vaccinated? There's been hesitancy. A lot of people say, I don't know. I don't know if I want to be vaccinated. But can businesses force people to get vaccinated as part of their employment?
Cannot in this current circumstance. The current approval for the FDA is called Emergency Use Authorization, which is a conditional approval, not a full FDA approval. And only medications or vaccinations in this case that are fully FDA approved can carry with them the capacity to mandate something. We're not expecting to have that from many of our businesses, but some healthcare entities are weighing the possibility because it's such a high risk to spread.
What about in Japan? Has there been a lot of hesitancy from people saying we don't want to get vaccinated?
Well, as far as I know, not yet. But what I've heard is, among the young people, sometimes they say that they are not sure about if they really have to get the vaccination or not. So this is the situation. But well, no, they are not in turn for the time being to be vaccinated. But by the time when they are in turn, I think they really think about it, and do hope that they will be motivated to be vaccinated.
I know there's a lot of questions, but we're running out of time in the public health section area. I do have one last question, and that's regarding vaccination certificate or a vaccination passport. How would that be done? First, let's hear from Dr. Ohmagari for Japan, and then Dr. Green on the US side. So the Japan situation first. What's a vaccine passport?
Well, I do know that there is the idea of the vaccine passport, but at this point, as far as I know, we don't have the plan. I have not heard of the official plan for the so to speak vaccine passport. So sorry for that.
Well, we want to be first in line. We want Hawaii to be first in line. So, Dr. Green, what about U.S. plans for vaccine passport?
I do believe these will become the standard of care. We are working right now as a state with two companies. One's called Clear and the other one is called Common Pass, where they'll be able to vet people's vaccinations and they'll go into an app like, on the iPhone or whatever, or Galaxy, whatever phone you got, and it'll be able to just show that you've been fully vaccinated and therefore essentially safe to travel. And it'll be good not just for travel, but also for large events. For example, this might be apropos of our group today. When we have the marathon here in Hawaii, hopefully again in December, it would be wonderful to be able to show large numbers of people that they were vaccinated and therefore no risk during the wonderful event that we share with Japan.
Well, thank you very much, Dr. Ohmagari and Dr. Green. This wraps up our discussion on the public health side of it. But obviously, we started talking about travel because that is so important for everything that happens between Japan and Hawaii. So now I'm going to turn it back to Reina, and we'll go into the second part of today's Japan current events. So, Reina?
Thank you, Barbara. And thank you again, Dr. Ohmagari and Lieutenant Governor Green. Thank you so much for joining us today. I would like to introduce our speakers on the resumption of travel side of the discussion. Mr. John DeFries is President and Chief Executive Officer of the Hawaiʻi Tourism Authority, HTA, and the first Native Hawaiian to hold this position. Mr. DeFries took over the helm of HTA last September in the midst of a pandemic that has wreaked havoc on our state's largest industry, tourism. Mr. DeFries will share his vision on the visitor industry and an outlook of what's to come. Eric Takahata serves as the Managing Director of Hawaiʻi Tourism Japan, which is the official tourism office in Japan for Hawaiʻi Tourism Authority. Mr. Takahata's work puts him deep in the throes of the pandemic, working with local and Japanese industry leaders to find solutions to reopen travel between Hawaii and Japan. Welcome, John, and welcome, Eric. So I'm going to turn it back over to Barbara now.
Thank you very much, Reina. As Reina mentioned, the travel industry is so important to the state of Hawaii. Dr. Green earlier showed slides of the terrible impact that it's had on our economy. There have been some suggestions and predictions from UHERO that we might be able to recover by the end of this year if the vaccine rollout is successful. So we'd like to turn first to John DeFries for an evaluation of the situation and what you think will happen for the remainder of 2021. So John, take it over, please.
Thank you, Barbara. And I'd also like to thank Dr. Ohmagari for his insights. It proved to be extremely helpful and insightful. And I never get a chance to thank Lieutenant Governor Green for everything he's done to advance tourism's ability to reopen. Reina, if we could, at this time, Eric Takahata would like to share screen for a couple of slides that we have. Could you make that possible?
Yes. Christy Ann, can you share Eric's slides, please?
Excuse me. Oh, hang on. Let's see. This is not the slides. I have John's slides. So is there a way that you can give me the, allow me to share John's slides?
Yes, you can share screen on the bottom of your screen.
Okay, I'm ready to go.
Okay.
Okay, is that showing up?
Yes, that is showing up.
All right. Eric, did you take my slides? Thank you.
No, no way, boss.
Yeah, we're the Tourism Authority, and as was announced, effective September 15th of 2020, I assumed the position of President and CEO, so I've been there roughly 5 months. Eric, next, please. You know, when I looked at your website and got refamiliarized, I certainly have heard of JASH over the years, but I was particularly moved by the statement about the relationship between Japan and the United States through the special and unique perspective of Hawaii. In that statement alone, I think that HTA has much to learn in refining its ways of relating internationally from country to country. Eric, please. So let me provide some context before we get into the details that Eric will provide. We ended the year 2019 just short of 10,400,000 visitors. It was the first time the state of Hawaii had surpassed the 10 million visitor arrival mark. Inside that number, there is represented $17.7 billion worth of visitor expenditures, 17.7 billion. So in your mind, translate that into the jobs, the businesses that derive benefit from that kind of visitor expenditure. Inside that expenditure, there was generated in 2019, $2.7 billion worth of state tax revenue, 2.7 billion. Now that is roughly the budget for the state's Department of Education. Inside that 2.7 billion of state tax revenue, $600.03 million were generated by transient accommodation taxes alone. And it is from that 600 million plus of transient tax accommodations that HTA derives its sole source of funding. So annually by statute, HTA derives 79 million for the fiscal year that is drawn down from a total transient tax fund of 600.03 million that was achieved in 2019. So we ended the year at this number. Eric, next. And 6 months later, the pandemic hits, the beaches are cleared, the hotels are cleared and empty, as are the attractions, restaurants, retail centers. We go from a banner year in 2019 to a number in July that hovers around zero, frankly. It was during that pre-summer in May of 2020 that Governor David Ige saw fit to stop the transient tax funding to HTA, essentially ordering HTA to operate going forward until further notice with the cash on hand. And so at that time, when that decision was made, the fiscal year budget for marketing and managing tourism in Hawaii was 86 million. The 79 million I spoke of earlier, and a 7 million carryover from the previous fiscal year. The decision to turn off the funding to HTA caused the board at that time and the HTA staff to go into a budget reduction process. So from 86 million, by the time I arrived at HTA, that number had been shaved back to 49 million. And since I've been there over the last 5 months, we've been able to take it back to 41 million, which will enable us to finish this fiscal year ending June 30. We anticipate the first 2 quarters of 2021 to be relatively mild and gradual in growth. And we look forward to a much more dynamic and robust 3rd and 4th quarter in 2021. Next slide, Eric. So given the dynamic of a banner year in 2019 and then the summer we experienced in 2020, brings us to the crossroads, to this street corner, where the top street is essentially closed and the bottom street is absolutely flourishing. But this equation and our ability to enjoy any kind of quality of life, quality of living in the islands requires that both of these streets flow fluidly, vibrantly, and in a resilient manner. And to achieve that, I often turn to kind of the advice of my elders, in this case, to a physicist from Europe. Eric? who essentially reminds us that we need to get to a new consciousness level. And I think that reflected in your statement, the American Society of Hawaii, this idea of looking at it from the perspective of Hawaii, in looking at this and invoking cultural values that are inherent to the Hawaiian culture, to the Japanese culture, and to the many multi-cultures that have made Hawaii home is appropriate. Eric? So when I look at this, what I see is kind of the mecca of Hawaii tourism. But in approaching this work at HTA and in competing for this position over the past summer, it was important for me to take it to a deeper place. And the mantra that emerged for me was Malama Ku'uhome, that my interest in pursuing the leadership at HTA had everything to do with caring for a place that I love. What we all have in common that are on this call and this Zoom tonight is this ability to connect to Hawaii, regardless of what our ancestry is, and make this connection to a very deep place. And that our actions today are motivated by this inherent love that we have for our homeland. Malama becomes the Hawaiian cultural value to protect, to nurture, to care for. Eric? And so in the first 100 days, this particular piece was written back in late summer to give me some sense of where I thought I would land, so that when I did get into office, I would have some sense of how to organize my time and priorities. Next slide, Eric. What was important in arriving at HTA, I thought, was to bring with me an organizing principle that would guide our work, and this Hawaiian cultural value of Malama, to protect, to nurture, and to care for, is something that I invoked on day one. Next slide, Eric. I would be overstating it to say that this mindset, this Malama mindset, actually came from me. It was already embedded in the industry. On a parallel track this summer, the Hawaii Visitors and Convention Bureau was well on its way to developing the Malama Hawaii program. Local nonprofits who choose to participate, combined with local hotel and industry partners, to create a program where when a visitor devotes a day of service to a participating nonprofit, a participating hotel will grant a complimentary night stay as a means of reciprocating for that service. I happen to believe that for visitors, that one day of volunteer service in our communities with a local nonprofit will be the highlight of their stay. Between 2014 and 2017, all of us witnessed Hawaii's voyaging canoe Hokulea go around the world on a voyage of Malama Honua to protect Island Earth, to care for Island Earth. And those of you familiar with the sustainable framework of Hawaii green growth called the Aloha Plus Challenge, you will be familiar with the Malama Mandate, which is a personal commitment that each of us as residents and citizens of Hawaii can make to moving Hawaii toward a more sustainable future. Next slide, Eric. A year ago in January 2020, what I also knew in arriving at HTA was that the board of directors in January 2020 adopted a new strategic plan for the years 2020 to 2025, the purpose to put Hawaii on a trajectory toward responsible tourism. They adopted 4 pillars that you see before you. Each of these pillars is like a fiber in a fabric. We brand ourselves as a destination because of the beauty and vibrancy of our natural resources. We brand and market Hawaii as a visitor destination worldwide because of the uniqueness and the feeling of inclusivity provided by the Hawaiian culture. We brand and market Hawaii around the world because of the sense of community well-being and a spirit of aloha that bonds us regardless of what our ethnic backgrounds are. And so I thought that the board of directors made a substantial move. Essentially, I interpreted this as the industry catching itself, because on its way to 10,400,000, we eroded some of our natural resources. We eroded some of the Hawaiian cultural fabric. We found hotspots in our communities that need to be better managed. And so this strategic framework provides myself and our staff, our partners, to be able to do our work. Next step, Eric, slide, Eric. Overlay onto that strategic plan, the pandemic and the economic collapse. And what we've identified at HTA is that the most responsible model of tourism today is called regenerative tourism. Regenerative tourism, however, is also reflected in our ability to regenerate capital and capital returns on capital investment. But it also calls for us to look 2-3 generations from now and be able to envision that during that period of time, for those generations ahead of us, that the natural resource base will be in better condition than it is today. That the vibrancy and the uniqueness of the Hawaiian culture will be advanced from where it is today. And the spirit that has bonded our community, that spirit of aloha and malama, will be better 3 generations from now than where we are today. Taking that regenerative approach, being able to envision what it should look like in 3 generations, now enables us to reverse engineer and be able to look at the steps we must take today. Eric? There are certain tools that we have. That book in the middle is the HTA Strategic Plan. It's available to you on the HTA website. Embedded in it is the Aloha Plus Challenge, the top left corner, which identifies 6 goals in sustainability to be achieved by the state of Hawaii by the year 2030. Bottom left-hand corner are the 17 goals of the United Nations Sustainable Development Agenda. Those goals were adopted in September 2015, also embedded in our strategic plan. And one of the leading nations in the advancement of these strategic development goals happens to be Japan, and Eric will comment on that later. Eric, next slide. As an extension of the strategic plan, a destination management action plan process is now underway on each major island. This is an opportunity, a process for communities to give voice to the model of tourism that they feel will be sustainable on their island, the model that will be regenerative for the future of their island. In effect, this process is inviting its participants, the community at large, and a diverse steering committee to malama their home, whether that home is Maui, Kauai, Molokai, Lanai, Hawaii, or Oahu. It's a mindset and it's a call to action. Eric, next slide. So when I go back here, and earlier I referred to it as the Mecca of Hawaii tourism, this particular shot is iconic all over the world. Next shot, Eric. Where that yellow arrow is the corner of Kalakau and Kapahulu. Our family home was 2 blocks inland behind what is today the Queen Kapiolani Hotel. So while I reside in Kona for the last 30 years, Waikiki is my home. When I say Malama Ku'uhome, next slide, what I see also is Waikiki when I was a kid. When I was a 5-year-old, this is what Waikiki looked like. It was a neighborhood. It was the beginnings of a vibrant tourism industry, but it was also the fishing grounds of my family and my neighbors. And you learn 3 things as a kid in Waikiki in the 50s. Waikiki was a source of food. Waikiki was a source of medicine. And third, Waikiki was a place of recreation, in that order. Next slide, Eric. And so at the time I was 5 years old, Disneyland was the international marketplace. This is what it looked like back then. And it's come a long way. Waikiki back then was beautiful. Waikiki today is beautiful, but we've got our work cut out for ourselves. Next slide, Eric. Last one. Let me just summarize by saying this whole process is an opportunity for us at HTA, for all of us as a community, to reimagine ourselves. Going back onto the competitive playing field against the global destinations of the world is going to be tough competition. And we need to redefine our value proposition to the US market and to the markets all over the world. Thank you for this time. Thank you, Barbara.
Thank you so much, John, for giving us such a personal explanation and description of Hawaii tourism and what it can be. I must admit, I first came to Hawaii. I was born in Japan. I first came to Hawaii when I was about 5 years old on a ship. And that's the Waikiki I also saw. And we were greeted by a beach boy who decided, oh, I'm going to take you kids around the island for a whole day. And we had such a wonderful time. But that's the Hawaiian hospitality that I remember and treasure. So thank you, John, for sharing what your Waikiki is like. And now we go to Eric. Eric, you're going to give us some specifics on the Japan market and some of the numbers that you're hoping to target for 2021. So
Yes,
Eric.
absolutely. Thank you, Barbara. I have my camera on. I don't know why it's not showing up. Maybe that's a signal that I'm more to be heard and not seen, but not a problem. I think Christiane has my slides and will be controlling my portion of it.
Yes, indeed. Go
Okay,
ahead.
Great. So thank you, everybody that's on this call for this opportunity. I hope that you are able to tell just by our leader, John DeFries, that we're all in very good hands for tourism. And I can't think of anybody else that would or should lead us from now and for the next, long time. And I really just really appreciate John's leadership's insight, his very holistic, cerebral view of tourism. And we are definitely going to adopt that and adapt it into the Japan market and how we recover the market. So let me go into some market conditions. Next slide, please. So when we look at what's happening in Japan, and we want to take the numbers, we want to show you these macroeconomic numbers compared to 2019. We see that we're not so way far off in the Japanese economy. Of course, some numbers that are a little concerning, but we are confident that they will rebound as your average household savings, consumer confidence. When you look at stuff like real GDP, quarter over quarter, Q4 of 2020 was up from quarter four of 2019. So we do see some promising macroeconomic indicators turning around and making the corner here. Next slide, please. Another thing that Japan is under right now is under their second state of emergency, and that is going until March 7th. The good news here is that it's not the entire country. It's only 10 prefectures out of the whole country. And we expect that after March 7th, with what's happening in country, that more and more prefectures will be lifted out of this emergency declaration. Vaccination started to roll out this month. And with no surprise, Japan being on time, they received their second shipment of the doses this week, and have started inoculating people on their timeline. Next slide. So when we look at the vaccination rollout plan, this is according to the Ministry of Health in Japan. Today, we know that they've procured over 300 million doses of the vaccine. And the three companies, of course, Pfizer, Moderna, AstraZeneca. And then we see the timeline that they've announced. And starting this month and going on into the year. So the goal by June, early summer, is to get about half of the population in Japan, half of the 126.5 million people that live in Japan or residents of Japan, to be vaccinated. Next slide, please. Some other larger macro indicators that we're watching. Japan, the government continues to inject stimulus money into the government. And of course, we're all excited, Barbara, and like everyone else is, that the Tokyo Olympics are going to go off in some way, shape, or form. Next slide, please. Some of these numbers, I'm going to have to put a caveat here. Please ignore our forecasts. These forecasts for Hawaii were done in early January for a lot of our stakeholders, and we are in constant communication with, for example, our airlines and our large tour companies, and they are indicating that these numbers are going to trend downwards for the first quarter and into quarter two. So we're in the process of revising the numbers that you see over here. The numbers I'd like to bring to attention to you is the upper numbers by the JATA, which is the Japan Association of Travel Agencies, up top. In 2019, you had over 20 million outbound Japanese going abroad. And then of course, last year that went down to basically virtually zero, right? But for 21, JATA is forecasting that Japan will make a 22% recovery of 2019 numbers for all outbound travel from Japan, of which Hawaii is expected to have a nice share of that, is what everyone is telling us in government as well as our stakeholders in the market. Next slide, please. Here's what your flight situation looks like for the first 3 months of this year. Next slide, please. Okay, I'm sorry. And so we do have the updated numbers for quarter two, which I'll be able to share later. I'll get that over to Reina and JASH so that they will be able to share with everyone in the organization. Some travel trends that we're following. Next slide, please. The outbound travel situation, the US, which includes Hawaii, is still under level 3 advisory. You know, it's a restriction by the Japanese government, encouraging Japanese not to travel if they can. And then the other thing here to report is that JATA, Japan Association of Travel Agencies, is busy working on a concept with the Japanese government to get around that 14-day quarantine for the returning residents, to present to them, to get to a proof of concept so that the Ministry of Health as well as the Japanese government can take a look at and be somewhat convinced that a managed type of tour product can be introduced for safer travels. And the JATA has identified Hawaii as its first foreign destination to test this pilot. Next, please. Consumer sentiment, we can tell you that we have our own consumer data of over 400,000 consumer data, you know, people that we could do surveys on, we can ask questions to. And this particular survey that was done late last year is a universe of about 8,000, a little short of 8,000 respondents. The good news is that over 50% of the respondents said that they would come back to Hawaii after reopening, which means basically if that when that 14-day quarantine in Japan is lifted, and then the timeline looking from about June into December. Next slide, please. Our target audiences, who we're going after, and this is really important to talk about just real quickly. With our recovery plans, you know, I think everybody was initially just, you know, really concentrating on just getting the numbers back to where they were. But as John pointed out, that's not going to work. If we get back to 10.4 million visitors as an industry, there's going to be a lot of unhappy people, and mainly talking about the residents. And because of the factors that John, you know, mentioned earlier, we need to have our residents accepting of tourism from every market, not only the North American market, but especially from Japan as well. So here's the target audiences that we are planning to go after beginning in 21. Next slide, please. So the common denominator of all of our target audiences, of course, is they're going to travel abroad at least once a year. They're willing to invest in self-improvement and well-being. They're globally conscious people and of higher income. And of course, that's part of us. What we're trying to do is we're trying to tax our infrastructure less, but get more spending, right? Is kind of the idea with going after a higher income traveler. And so why we went after this, why we identified the target audience as such was because of these main factors down below. You see in the parentheses, spending potential, desirable attributes, and of course, the segment size. Next, please. And these are kind of 4 personas that we developed to be able to kind of articulate who we're going after. You know, the affluent families and the couples, these are segments that have been around since a very long time, for decades. And we will continue to go after these segments. But new ones to introduce here are the potential Pono travelers and the new norm workers. Next slide, please. So we talk about potential Pono travelers. You know, these are some of the attributes that they display. But I think the fourth bubble under potential Pono travelers encapsulates it the best. This market holds, or segment, sorry, holds an ethical mindset with the environment and society while showing interest in SDGs. And like John mentioned, the Sustainable Development Goals developed by the United Nations and then adopted by Hawaii in the Aloha Plus Challenge are very, very huge. It's a very big movement initiative. Social awareness in Japan is amazing. Pre-pandemic, you would get on a flight, JAL, ANA, any of the Japanese carriers, and all of the cabin attendants would have a SDG badge on their lapel pin, and they were able to speak to SDGs, and it was pretty impressive. But this will be key to us recovering in the Malama mindset that John talks about. And then the new norm workers, right? This gave the pandemic gave new opportunity for us to realize that there's a segment of the workforce in Japan that is not bound by geography. They're not bound by having to physically go to an office. They can come here to work remotely. They usually have more resources to do that and are not so bound by geographic and time constraints. Next slide, please. Where are they located? No surprise, these are the 5 regions that we're looking at. And of course, these are the 5 regions that we have direct flights out of, pre-pandemic even as well. Next, please. So our consumer strategy, next slide. So, you know, the consumer strategy and the trade strategy are the same. And I'm going to kind of zip through this just to save time. But for now, because of what's happening in Japan and the US, you know, the first half of this year, until June at least, will be spent on continuous engagement with the consumer market as well as our travel trade. We have to keep them engaged. I can tell you that there are other countries, other destinations that are starting to pour in major resources into Japan to try and woo the Japanese visitor coming out of this pandemic. It's obvious, right? The Japanese traveler has always been a traveler that the rest of the destinations are wanting. Well, we have been very blessed to have on any given year about 1.6 million visitors from Japan to Hawaii, spending anywhere between $225 and $250 per person per day. So the consumer strategy is to keep engagement for the first 6 months until we see robust recovery from July. Next, please. And then, you know, for our consumer strategy at HTJ will be to go after the consumer in a more robust way in the second half of this year, which we see the majority of the market recovering in Q3 and Q4, but a nice ramp up in Q2. Next slide, please. Our trade strategy, what are we doing with our airlines, our wholesale partners, our online travel agencies? We're fully engaged. I want to say we talk with these people at least 3 to 4 times a week, both in Japan and Hawaii, of course. And thank God for Zoom, right? Or these digital platforms that allow us to do that. Next, please. So in the same way, the trade will be engaged, and we keep them engaged with us so that they don't go looking elsewhere, like Australia, like Vietnam, like Hong Kong, who are trying to poach on our potential visitors with all kinds of stuff. We need to remain top of mind in the trade industry. Next slide, please. And the second half, again, we'll go full court press, full-blown recovery mode, and we will collaborate with everyone and anyone in the travel trade industry that sells Hawaii, because it's super important for them as well. Next slide, please. Just some images of what it used to be like pre-pandemic. We are very much engaged with the industry and will continue to do so both here and Japan. Next, please. So in a nutshell, where we see our positioning is more on a DMO level. We're not only branding and marketing our destination. We touch these different circles both in Hawaii and Japan, and we truly serve as a bridge to the 2 island nations. And one part I'll point out is that we've been really just blessed with a network of connections and people in the government on both sides here in Hawaii and Japan. And I'll say that we were the first international market to set up safe travels with Hawaii. And that was largely due in part to our government working very nicely with the Japan government through us. And LG Green was awesome. He did a lot for us in those times, setting safe travels up with Japan. And this is how we view our handling of marketing, not only marketing Hawaii, but taking care of Hawaii as a destination. Next slide, please. The 4 pillars, as John mentioned, we are constantly in the Japanese market. This will run through everything from our consumer strategy, our trade strategy, so on and so forth. Next, please. Responsible tourism. Next, please. This basically for us is Malama. And I can't, when John introduced this concept to us, we were just floored because Malama is a whole philosophy and really easy for the Japan market to adopt. And so we have some projects coming on 21 that will really just initiate and implement this Malama initiatives into Hawaii, marketing Hawaii in Japan, because we want to bring back the Japanese market in a proper way. We just don't want to get heads in beds and butts in seats on the plane, but we want to really bring back the Japanese market in a responsible way. And to us, how to bring them back in a responsible way is Malama. Next, please. So this is one example. We have many initiatives coming on. We are working with Malama Honua, the Polynesian Voyaging Society, where we're also working with the Iolani Palace, Bishop Museum, to help them even fundraise in Japan. And that's part of Malama, is taking care of our iconic nonprofits here in Hawaii. And we're making sure that we take care of these 3 important ones. We are going to start our Malama mask initiative. And this is going over really well in our focus groups and our research groups. So, look forward to these kinds of initiatives coming out of Japan soon. Next, please. Top takeaways. Next. So winding it down rather, for HTJ, we want to take the industry shutdown and look at it as an opportunity. In Japanese, there's a old saying that says, pinch wa chance. When you're in a pinch, it equals a chance. And so in this chance that we have, again, to reimagine Hawaii, it's going to, we will be focused on elevating Hawaii's brand, bringing safety, health, and wellness to the forefront, and winning back the confidence, not only of our Japanese visitors, but also of our residents towards Japanese tourism. Next. We'll focus on our most valuable visitors, the Pono travelers. And Pono travelers is basically all the segments that I showed you earlier. And it's to cultivate high value, very mindful, responsible travelers that are interested in something that is bigger than themselves. Next, please. So this is the last slide for me, but the pathway we see to recovery is to continually work close with our governments, with our private sectors, with our industry. We need to continue to assess the competitive landscape. Like I said, there's a lot of other destinations that are going after the Japanese market and want to woo them away. And we also need to realize new opportunities and develop new markets, such as that new norm worker that I talked about earlier, who can work from Hawaii and have the resources that can increase their length of stay, so on and so forth. And then offer quality programs to bounce back demand to Hawaii and get back to economic recovery for the state from Japan. And that's all I have. I thank you for your attention, and thank you for letting me share.
Thank you very much, Eric. And thank you also for John for explaining the Malama concept and the ku'uhome idea, because I think that truly is Hawaii. We've had a number of questions, but I'd like to begin with the idea of a travel bubble between Hawaii and Japan, because there's still barriers to increasing the traffic between the 2 countries, or between Japan and Hawaii. The 14-day quarantine requirement for entering Japan, and then of course our concerns about the infection rates. So is there a possibility of establishing a travel bubble so that there can be more visitors with less restrictions between Japan and Hawaii? So, John, let's go to you first.
Let me ask Eric to comment on that, because Eric's been working, going back in the summer when the travel bubble first was a concept being developed. Eric was intimately involved with House Speaker Saiki, Governor Ige. Eric, please comment on that.
Yes, we were working on that, like John said, from last summer, and we, to tell you the truth, we got close to establishing a travel corridor with Japan. But what happened was that second wave that Dr. Ohmagari, commented on, and that's, it kind of dashed those hopes. But we were very close in setting up a travel corridor with Japan. What happened after that, we went into Q3 and Q4, and this case counts started to spike both in Hawaii and Japan. And the Japanese government, wanted to go in a different direction. The 14-day quarantine that you speak of is the roadblock for getting, both travel to Japan as well as from Japan going. Once that's lifted, and we're thinking that could, that should happen in the first half of this year. We're very, very optimistic that happens in the first half of this year. Before June is what we're gunning for. That will make it significantly different from, traffic from Japan.
But Eric, don't you think that right now the situation is even better in both Japan and Hawaii than at the time that the travel bubble was discussed several months ago? I mean, the numbers are down. There's more receptivity on both sides. Isn't this a time to press harder now?
Yeah, yes, and we're pressing harder. You're absolutely right. Case counts going down. Vaccine rollout on both Japan and the U.S. Olympics, hopefully, fingers crossed, to be officially announced next month. I know that here, in the U.S. media, there's already the TV contracts and everything are being worked on already. So it's as if everybody expects the Olympic Games to go off. So we do have a different set of positive indicators at this point in time to really get it to a reality as far as a travel corridor, a carve out for Hawaii from the rest of the U.S. Whatever we want to call it. We'll continue to work with our government and the Japanese government as well.
Yeah, no, Hawaii wants special consideration. We want a complete waiver. Of course, we're not going to secede from the union. We just want, special consideration. So let me ask John about you had mentioned that, we can't go to 10.4 million again. The community here won't stand for it because during the time of isolation, we were able to see how beautiful our beaches are, how clear the ocean is, and how wonderful the natural sea life came back. So if we look forward to this reimagined Hawaii visitor experience, what will that be, and how will it engage the Native Hawaiian community more than it did in the past?
When the whole system went down as it did this past summer, it created this window for us to start looking at meaningful change. And I think that we have identified the hotspots. We kind of know where they are on every island. We have people on every island who have identified them and have come up with remedies. There's going to need to be some public policy change and legislation that will help us, protect this. But I will tell you that what we're looking at two things, because on one hand, we had 10 million for 6 months later, we're hovering around zero. And you start looking at the impacts. And so every week I talk to somebody that says, John, we got to cap it at 8 million. And the next hour I'm talking to somebody who says, John, we need 12 million. We just need better management systems to operate this. So going back, you made the comment about UHERO earlier. I just met with them last week. They're looking at a amended projection for 2021 of 4.9 million and the following year at 8 million. That doesn't give us a whole lot of time to start putting actual management systems into place so that we're either restricting high volumes of traffic at given hours. But we've got, in that destination management action planning process, we're really relying on the communities of each of these islands to give us that guidance, give us that definition. HTA will then help them at the county and state levels to get the kind of public policy support that we need to go forward.
Well, that sounds like a plan, but it's always very difficult to get the legislators to come through. You're mentioning a timeline that's very, very short, and we're already in session now. Are there any particular initiatives right now at the legislature that you feel will be helpful to reopen the visitor market and specifically to help us with Japan?
You know, in the first 2 years, what as an industry, what we're not advancing, which are, and there are a couple of bills there, is added taxes and added fees, which across the industry and across all markets, not just Japan, we feel would be just an added deterrent to the traveler. And there are testing costs that they're now bearing that they'll continue to bear for, you know, the near-term future until vaccines are in place. But however, what I will say is this idea that the industry should be a greater support to protecting our natural resources, putting the kind of manpower that we need to manage certain areas. We see examples at Hanauma Bay, at Diamond Head, at Haleakala. We just need to be able to scale those types of solutions across the state more efficiently and at a greater pace.
Well, thank you very much. I know we have other questions, but we've run out of time completely. We want to thank Lieutenant Governor Josh Green, who had to leave early, and Dr. Norio Ohmagari, who also had to sign off. So Reina, I'm going to turn it back to you before we all turn into little pumpkins because it's almost 5 o'clock.
Yes, thank you. Thank you very much, John and Eric, for that great presentation and insight into what's going on here in Hawaii and Japan. Of course, you know that we in Hawaii are anxious to get back to Japan, and we also know that our Japanese friends are anxious to come back here. So we thank you for your hard work and dedication to this mission of getting us to be able to travel, to Hawaii and Japan. Thank you so much. And thank you also to Dr. Ohmagari and Lieutenant Governor Green for being our speakers today, and to Barbara Tanabe, our moderator. She's so great. Thank you so much for moderating today's program. Domo arigato, and thank you to all of you for attending today's program, Japan Currents program. If you enjoy programs like these, please consider becoming a JASH member and registering at our website, www.jashhawaii.org, jashawaii.org. If you're already a member of JASH, please consider making a one-time tax-deductible donation so that we can continue to offer these types of programs. Again, our website is www.jashawaii.org. So our next exciting program coming up is under our Women Who Lead series, coming up on Thursday, March 18th at 12 p.m. Our guest speaker is Tana Dang, who is the owner of Eden in Love, a boutique located in Honolulu and Las Vegas. Tana's a local girl, She and her husband started this business, and Tana will share with us how she reimagined her business and continues to thrive even during the pandemic. So please join us. Mahalo everyone for attending today, and we look forward to seeing you at our next program. Thank you.